So let me tell you about the one and only time I had rectal bleeding so that you are aware that doctors can have symptoms too. Now, many moons ago when I was in medical school in university, I had a poor diet. I wasn't eating very well. I was too busy studying and I was probably stressed as well. When you have exams, courses, assignments to do. So I had an episode where I began to experience rectal bleeding in the form of wiping. When you wipe and you see blood on the tissue, and you're like, how is this happening? Where is this coming from? And to be honest with you, I don't remember straining or being constipated that would have caused blood in my stools. Now, if you have the one-off episode, that's fine. But if it happens over the next few days, then alarm bells start to ring. And knowing what I know with my medical knowledge, you're like, oopsie, what is this? What could this be? And this is the problem when you know too much. But on the other hand, the advantage of knowing too much in terms of medical knowledge is that you can kind of rationalize it and not just think the one and only worst possible thing, like, oh, this is cancer. You can actually rationalize and now come up with differential diagnosis. Is this cancer? Is this, hemorrhoids or bowels, or could this be polyps or could this be something else? I mean, there is not many conditions that can cause rectal bleeding, to be honest with you. So what happens next is obviously I go to my doctors and I tell them, look, I've got rectal bleeding. I've noticed blood in my stools. The doctor takes my history. They ask me for what we call red flag symptoms. And what are red flag symptoms? Red flag symptoms would be, have I had rectal bleeding for more than 6 weeks? Is it painful or painless rectal bleeding? Painless is more of a red flag symptom because if it's painful, it could be that you're straining, you're inflamed, and you've got bowels. So you want to have painful and not painless rectal bleeding. Have I had a change in my bowel habits? Have I had a change in terms of, am I more constipated? Am I having more loose stools? Or is it like alternating loose and hard stools? And has this been going on for more than 6 weeks? Have I experienced any other symptoms such as weight loss of appetite, bloating, even indigestion that has been going on for a period of time, more than 6 weeks, will be considered as a red flag symptoms. So these are symptoms that might point to a more serious condition that would warrant you to have further tests such as a stool test to check for any signs of cancer. There's a special stool test called the FIT test that will check for signs of cancer. If you're suspecting any inflammatory bowel condition, there's another test called the fecal calprotectin test. And this is just so that you know that this is something that you can go and approach your doctor about. If you feel your doctor is fogging you off, just ask specifically for these tests. Can I have a fecal calprotectin test? Can I have a stool test? Can I have both? And usually, if they find that there's anything suspicious from the history or from the stool test, then they might warrant you being referred for a colonoscopy, which is an invasive camera test that goes up through the bowel, and then you might have biopsies, which are then sent to the lab for testing to make sure that there is nothing sinister going on in your system. As it would have in my case, it turned out that the doctor examined me and I was found to have external hemorrhoids. External hemorrhoids are basically projected blood vessels on the outside of your rectal or anus, where basically the blood vessels are bulging out, they engorge of blood, they become inflamed, and if they become friable, then they can actually bleed easily, which is what happened in my case. They were quite friable, which means that the skin was quite thin, so they burst easily, and then you noticed blood on the tissue. So the hemorrhoids told me, as I said earlier, I had a poor diet, I wasn't eating enough fruit and veg, I wasn't drinking enough water, I was stressed. So having a poor diet can cause weakness of the wall of your bowel that can also cause hemorrhoids. So to prevent this, I would advise drink plenty of water, eat more fruit and veg, increase your fiber diet, try to avoid straining as much as possible. Also try to avoid heavy lifting because heavy lifting, even weights, can cause increased pressure lower down that could also cause hemorrhoids. Now, I hope you enjoyed this video. If you have any questions, please feel to drop any comments below and subscribe to my channel.